Hi everyone, welcome back to my channel. In today's video, I am sharing all the supplements that I am taking during my second pregnancy. I think during my first pregnancy, I was more conservative. I was more cautious and scared to take any supplements besides basically my prenatal. This time I'm more educated, more aware. I do have a holistic midwife who is aware and informed about all of the herbal and supplemental things that we take during pregnancies that are safe and beneficial. So compared to last pregnancy, I took one supplement, which was a prenatal, and I think I took Garden of Life organic prenatal. This time I'm taking 7, 8, 9, between 8 and 10 supplements every single day. And they are definitely beneficial. I'm seeing and feeling the benefits of each and every single one of them. And I will go ahead and show you guys the pictures of them and review them more in depth. If this is your first time tuning into my channel, my name is Katie. I am a registered nurse and I am very passionate about holistic care and informed consent. So everything in here, please take it as not advice, but consult with your healthcare provider before starting any of these if you are interested. So the first one, and again to add, some of these are more specific to my pregnancy because I did have a C-section last time. So for example, one of them or two of the supplements are more for the C-section and the scar healing, but it's been over 2 years since my C-section. So to begin, I am taking the Seeking Health Prenatal Essentials. They have 3 or 4, I believe they have 4 prenatal options. This is the Prenatal Essentials capsules. So they are 2 capsules a day. It's very important that if the dose is more than 1 a day, that you spread them out and not take all of them at once, because our bodies are only able to absorb certain amounts of nutrients in one dose or in one intake. So that's why it is important to spread them out. Also, when it comes to a prenatal, it is so important that it is folate or methylfolate, or at least folinic acid. It is so important by all means to avoid folic acid, which is synthetic, unless you have been tested for the MTHFR gene mutation. A lot of women and men do have this gene mutation, which prevents your body from converting folic acid, its synthetic form, into methylfolate, L-methylfolate, which is the active bioavailable form, as well as their other product, which is Prenatal Essentials, comes in a methyl-free form, which is folinic acid. And that is also important to keep in mind. If you do have MTHFR gene mutation, your body will not be able to convert folinic acid, which is organically occurring, into methylfolate, which is active in what our body needs. So I think it's always safe to just go and use folate or methylfolate. The better option, if you are able to afford it, these are expensive, but if you're able to afford the better option and if you have no problems taking a lot of pills, is the optimal prenatal by Seeking Health, but it's 8 capsules a day. So I did take that one for a few months before conception, and I think I spread them out into 2 capsules with breakfast, lunch, dinner, and somewhere in between snacks. So that is my prenatal. I'm also taking a daily probiotic. I'm taking Claire Labs Therabiotic Women's Formula. Looks like that. This is, so the prenatal is a 1-month supply. There's 60 capsules so 30-day supply. This one has 60 capsules, and it is a 60-day supply because you take one a day. And I do take this on an empty stomach before breakfast. I've noticed significant improvement with my digestion, especially with constipation in the first trimester when I started taking this. And I've tried other probiotics during pregnancy, like the first month or so, and none of them worked. This one worked immediately. The next one is Nordic Naturals Prenatal DHA. It looks like this. I know some holistic midwives increase the dose and just use the basic, not the prenatal, but the regular DHA by Nordic Naturals. And it's for women who have ADHD, so fish oil, omega-3s and 6 are known to help with ADHD. So I take 2 a day, 1 twice a day. So 1 with breakfast, 1 with lunch usually. They're pretty small capsules and they're very soft, so they're soft gels. There is 90 capsules, so that is a 45-day supply. The next one is the Natural Vitality Calm Magnesium Supplement. They do have a powder form. I don't like powder. I feel like this is more convenient. Gummies are not my favorite. I would not take a gummy in, let's say, a prenatal or many other things, but for magnesium, I feel better about taking a gummy. And just looking at the ingredients, there's basically no synthetic or harmful additives to here. So I'm almost out. This is the raspberry lemon flavor. And they look like this. They're like little gummies. They're pretty chewy. And they're coated with little sugar, like sugar granules. It does say take up to 4 daily. I have been taking 2 a day before bed, and I noticed that I don't have as much growing pains as I did last pregnancy, and I don't have as much cramping. I did skip a few days of this magnesium supplement and I felt more cramps. So I definitely feel the effects of that. I also take Thorne Iron Bisglycinate Iron Supplement. Looks like this. It is 1 capsule a day, and this is a 60-day supply. It is so important to take iron bisglycinate, not ferrous sulfate or other things. This is the most beneficial type of iron because our bodies are able to digest it and process it, so it's more bioavailable than other forms. And it does not cause constipation for me. It is known not to cause constipation, and is also known not to cause stomach upset. The next 2 supplements, my midwife put me on these. I would have not taken them myself if she were not to suggest them to me. And they are more specific to the reason of the history of me having a C-section in the past. So with you or anyone else, me attempting a vaginal birth after cesarean, it is important for us to maintain and support the integrity of that incision, of that cut, the C-section cut, as the uterus stretches to support its integrity so it maintains stable and does not have any separations. My midwife did say she will do an ultrasound in my 3rd trimester to just make sure the cut, the incision, is all stable. And if at all there's anything of concern, I would have to do a repeat C-section. But the first one is Vital Nutrients Vitamin C with bioflavonoids, like this. It contains 1,000 milligrams of ascorbic acid and 500 milligrams of citrus bioflavonoid content. I take 2 capsules once a day, And again, I spread them. So 1 capsule in the morning for breakfast and 1 capsule in the evening or afternoon for lunch or dinner. And that really helps with immune system as well, as it is 1,000 milligrams of vitamin C. The next one is organic collagen from grass-fed beef bone broth. My midwife did not tell me to take this specific company or this brand, but I just don't like powders. I know Vital Proteins has the collagen powder. I just don't like powders as much. So I found this Dr. Mercola organic capsules. And this is 3 tablets a day on an empty stomach, preferably. These are really big and I do have a hard time taking them. So I'm supposed to take 3 of these a day. I feel like they're really big. So I do struggle with that, but I have to work through this whole bottle. So if you don't mind protein powders, or not protein, like collagen powders, that's obviously an easier alternative. The next one is Seeking Health Vitamin D. I have been taking this pre-conception, but I still continue taking this. It has 2,000 units per drop. Again, the prenatal has, I think, 4,000. Oh no, it only has 1,000 units. So I take 2 drops for a total of 4,000 units. Plus 1,000 in my prenatal, so 5,000 units a day. And the next 2 are as needed. So DMannose is for UTIs or just bladder health, urinary tract health. It cleanses the bladder. So if I feel anything, or just as a preventative here and there, I'll take 2 to 3 capsules before bed. So it just really coats my bladder, gets rid of any additional E. coli bacteria that may be in there. And then the last one is this pregnancy cold and flu tincture. It's 1 dropper full every 2 hours for 1 to 2 days. And then 4 times a day. So every 6 hours for up to 2 weeks. So a week to 2 weeks. And this is basically an echinacea tincture. Echinacea is safe to take during pregnancy. So just 1 dropper full. It is very mild tasting, but I have taken this a few times so far. I have not taken it as directed. I just take it when I feel a little bit of symptoms, and then I stop. And then of course I focus on a healthy nutritional diet and lots of water, avoiding processed foods, sugars, and just eating healthy, drinking lots of water. I started exercising, prenatal exercises. So really trying to stay healthy and active is so important on top of these supplements. If you are interested in linking to me linking any of these, let me know in the comments. If you have any questions, let me know. Otherwise, I hope you guys enjoyed this video, found it helpful, and give this video a like and subscribe for my channel. Thank you. Have a good day. Bye.